Hello everyone. Today we are going to be looking at what you should know about COVID-19. So without further ado, let's get into the video. COVID-19 is a respiratory condition caused by a coronavirus. Some people are infected but have no symptoms. Doctors call that being asymptomatic. Most people will have mild symptoms that will go away on their own. However, some people will experience severe problems, such as difficulty breathing. If you are older or have another health condition, such as diabetes or heart disease, your chances of developing more serious symptoms increase. Here's what to look for if you suspect you have COVID-19. Common symptoms. The following are the most common symptoms experienced by people who become ill with COVID-19. Chills or fever. Shortness of breath and a dry cough. Excessive tiredness, muscle or body aches. Headache. A loss of taste or smell. Throat discomfort. Runny nose or congestion. Vomiting or nausea. Diarrhea. These symptoms can appear anywhere between 2 and 14 days after coming into contact with the virus. Emergency symptoms. If you have any of the following symptoms, contact a doctor or a hospital right away. Breathing difficulties. Chest pain or pressure that is constant. Lips or face that is flushed. Unexpected perplexity. Having difficulty staying awake. If you have any of these symptoms, you should seek medical attention as soon as possible, so call your doctor's office or hospital before you go. This will help them prepare to treat you while also protecting medical personnel and other people. What you should know about COVID-19 and travel. With more people traveling again, you may be wondering what is safe. It is primarily determined by whether or not you have received the COVID-19 vaccine. Here's what you should know if you're planning a trip. What if I'm fully vaccinated? Fully vaccinated means you have received the greatest level of protection from your COVID-19 vaccine. There is one exception. If you have a weakened immune system due to a medical condition or medication, consult your doctor about what precautions you should continue to take. Even if you are fully vaccinated, you must wear a mask when traveling by plane, bus, train, or other modes of public transportation. You'll also need to disguise yourself in airports and other transportation hubs. Masks are required because there is still a chance that you will catch the virus, become ill from it, or spread it to others. If you notice COVID-19 symptoms after you travel, get tested for the virus and stay home. What if I'm not vaccinated? It is dangerous for you to travel if you have not received the COVID-19 vaccine or if you do not have full protection. You are not considered fully vaccinated until you have completed the following steps. 2 weeks after receiving your second dose of a 2-dose vaccine, such as Pfizer or Moderna. Johnson & Johnson recommends 2 weeks after a single-dose vaccine. People who have not been immunized are more likely to contract COVID-19 and spread it. That's why it's advised to postpone trips until you're fully vaccinated. Don't travel if you are feeling ill. Recently had a COVID-19 test and are awaiting the results. Recently received a positive test result. Or if you believe you've been in the presence of someone infected with COVID-19. If you must travel before being fully vaccinated, take precautions to protect yourself and those around you. Get a COVID-19 test 1 to 3 days before your trip. Wear a mask when traveling by plane, bus, train, or other modes of public transportation. Wear a mask in airports, train stations, and other transportation hubs. Keep at least 6 feet away from people who aren't traveling with you. Wash your hands frequently or use a hand sanitizer containing at least 60% alcohol. Also, find out ahead of time if the location you'll be visiting has quarantine requirements for when you arrive. To learn more, contact your state or territories or local health department. Does it matter how I travel? Traveling and being around people who do not live in your household increase your risk of getting and spreading COVID-19 even if you are fully vaccinated. Following these guidelines can assist you in protecting yourself and those around you while going about your daily activities or planning vacations. Vehicle for personal use. Only those who are absolutely necessary should travel in a personal vehicle. You do not need to wear masks if everyone in the personal vehicle has been vaccinated. It's also a good idea to improve ventilation by rolling down the windows or switching to non-recirculating mode on your air conditioner. Wipe down the door handles, steering wheel, and dashboard with a sanitizer containing 60% alcohol before using a rental car. When you arrive at your destination, wash your hands for at least 20 seconds with soap and water. Public transportation. Wear a mask over your nose and mouth if you're taking the bus or train. Maintain a social distancing distance of 6 feet between yourself and other riders. To maintain distance, skip a few rows of seats. Travel at off-peak times. Avoid touching too many different surfaces. At travel hubs or stations, avoid huddling in groups with other riders. And that's it for today, everyone. Hope you guys learned a lot about COVID-19 and how to handle it if you get infected with it. See you guys tomorrow with another exciting health tip video. Subscribe to our channel and click on the bell icon to receive instant updates on our videos.